You enter a room with a 4-year-old boy and his mother. She's worried because he's had many symptoms that look like some of the symptoms his father's had. 2 months ago, he had fatigue and shortness of breath, and 2 weeks ago, he had a UTI that was treated with antibiotics. For the last 5 days, he's had yellowish eyes. His LDH is elevated and his hemoglobin is low. He has splenomegaly, and his father has a history of splenomegaly that led to a splenectomy. What's the likely diagnosis? Hereditary spherocytosis. What leads to this? Spectrin deficiency. What does this do to erythrocytes? It decreases the surface area of erythrocytes. So spectrin is used to give red blood cells their shape. How does this cause splenomegaly? Red blood cells get trapped in the splenic vasculature. What type of anemia is this? Normocytic. So the red blood cells are a normal size. What happens to MCHC and RDW? Both of them increase. What type of hemolysis occurs with this? Extravascular hemolysis. What are 2 signs of extravascular hemolysis in general? Increased LDH and indirect hyperbilirubinemia. So how would you know this isn't G6PD deficiency? The fact that MCHC has increased is one thing that tells you that this is not G6PD deficiency. Also, you're seeing this 2 weeks after a UTI. So you had a UTI 2 weeks ago that was treated with antibiotics. What's the mode of inheritance for this? Autosomal dominant. In general, what is MCHC? It's the average hemoglobin per red blood cell volume. What does a low MCHC lead to? Usually a lack of energy.